Good afternoon, everyone. Today we're going to take you through a presentation all about hypertension. We'll cover a variety of topics to help you understand the complexity of this condition and the different strategies used to prevent it. Before we dive in, we're going to start with a short case study. Isabella, a 53-year-old woman from America, is part of the lower socioeconomic class and often relies on fast food as her main source of nutrition. She visited her primary care physician due to recent changes in her urination. She also experiences occasional headaches, though they resolve within minutes. Her medical history includes a family history of kidney disease and a history of alcohol abuse. On examination, her blood pressure is elevated at 160 over 105 milligrams mercury. Her doctor advises her to take her blood pressure often to see if it is always elevated. After 2 weeks of measuring her blood pressure, it is consistently at 150 over 95. She is 5'8" and weighs 155 pounds, with no other significant abnormalities noted on the physical assessment. The first three topics will cover the background of the disease. Before we dive into chronic hypertension, we will quickly describe what hypertension is. First, we will go through the various definitions of chronic disease and relate it with hypertension, including how the disease is complex. And then we will cover the descriptive epidemiology of it, which includes the who, when, and where of the disease. After that, we will cover the signs and symptoms of hypertension. That covers the background of the disease. Then we'll dive into rehabilitation strategies and programs. We will then finish off with analyzing a research publication about the rehabilitation strategy. At the very end, we will go over the case study relating it to our presentation. So, what is hypertension? Hypertension is when there is a higher than normal force exerted by blood on the artery walls. Therefore, the heart has to work much harder to pump blood throughout the body. Hypertension is when your blood pressure is consistently above 130 over 80 milligrams mercury. That's considered stage 1 hypertension. If it gets even higher, it moves into stage 2 or stage 3 hypertension. Just for reference, a normal blood pressure reading is around 120 over 80 milligrams mercury.
Let's move on to hypertension as a chronic disease. So, there's no distinct definition of chronic disease, but chronic diseases are generally characterized by a number of traits. First, they have multiple risk factors. As for hypertension, this condition is caused by a number of things. Starting off with the non-modifiable risk factors. These include increased age, which is actually a major risk factor. Others tie into sex, which we'll look more into later. However, most risk factors are modifiable. This means we have control over them. These include physical inactivity, smoking, alcohol use, and a poor diet. Most critically, a high sodium intake has been associated with 32% of cases. So because of all of these risk factors, hypertension often has an uncertain etiology. It's difficult to determine exactly which factor caused the hypertension, or if it's a combination of multiple factors. Second, chronic diseases have a long latency period. Hypertension is a very slow progression, taking years, even decades to develop. Plus, the early stages are asymptomatic. Third, it affects a person's quality of life. Having hypertension may lead to fatigue as the increased blood pressure strains a person's heart. In addition, there is a major financial burden of hypertension. Since it often appears with secondary illnesses, it can cause the person to have many healthcare visits, right? Finally, hypertension isn't considered curable, which lines up with chronic conditions. There is always that chance of reoccurrence. However, though, it is manageable and it is preventable. In addition, other aspects of hypertension that align with chronic disease characteristics is that it's not contagious, there's a prolonged course of the illness, so in other words, it persists for a long duration. On top of being chronic, there are many aspects that make the disease complex. One of the major reasons is the comorbidity. So what is comorbidity? Comorbidity refers to a person having two or more conditions at once. Hypertension is both a risk factor for other illnesses and a result of other illnesses, so it often does present simultaneously with other conditions. Over 70% of hypertensive adults are living with at least one other comorbid condition. The most common of these include cardiovascular disease, diabetes mellitus type 2, and chronic kidney disease. Another major characteristic that makes hypertension complex is the healthcare utilization, as I briefly mentioned earlier. Some factors are the frequency of hospitalizations, visits to physicians, and emergency department visits. Hypertension was the most common reason for visiting a clinician in 2020, along with respiratory infection. 23.6% of emergency department visits were related to hypertension. So overall, hypertension is a complex chronic condition.
Let's see if you guys are paying attention. Question 1. Which of the following is a significant risk factor for chronic hypertension? A. High physical activity. B. High sodium intake. C. High socioeconomic status. D. Female teenagers. The correct answer is option B. High sodium causes increased pressure in the blood vessels as it retains water.
Now we're going to move on to the epidemiology of hypertension. So first off, we're going to look at where in the world hypertension is most prevalent. So firstly, hypertension is most prevalent in low and middle income countries. So all the countries you see here on the screen are either low or middle income countries. The top three most common countries for men include Paraguay, Hungary, and Poland. And the top three most common countries for women include Paraguay, Tuvalu, and Dominica. You can see here that Paraguay has the most common prevalence of hypertension in anywhere else in the world. And the reason for this could be due to the fact that they have limited access to healthcare, their insufficient awareness about hypertension, and also the unhealthy lifestyles like consuming unhealthy food and not engaging in physical activity. Additionally, socioeconomic factors and cultural influences around seeking treatment contribute to the high prevalence rate in all of these countries here. So now we're going to move on to who is more affected. So as you can see here by the picture, hypertension will increase as you get older, as age increases. And the most common is in older postmenopausal women. And the reason they are postmenopause is because after menopause, there's a decrease in estrogen, which is a protective factor for the heart, and this increases the risk of developing hypertension. Surprisingly, though, young men also have a very high prevalence, and this is most likely due to their bad lifestyle, such as smoking tobacco or drinking alcohol, which are two, though, very common modifiable risk factors. The most common ethnic group that's most prevalent to develop hypertension is African Americans, and this can be due to their adverse social terms of health and the conditions in which a person lives and the conditions in which they are born in. Moving on now to when hypertension began to develop, it started to increase globally since starting from 1990. That's when hypertension began to become a big problem globally. And the number is from 650 million in 1990 to 1.28 billion as of 2019. You can see here in the graph shown that hypertension, the most common hypertensions diagnosed are the ones that actually people don't know they have until very later on. And this increases the risk of hypertension becoming very unnoticeable, and then people unfortunately will pass away from it. But the biggest thing to look at here is that currently 1.39 billion people worldwide are living with hypertension, and this number to this day is still increasing. And as mentioned previously, most hypertension cases are undetected, so majority of people in this huge number don't even know that they have hypertension.
Question 2. Which country currently has the highest prevalence of hypertension? A. Paraguay. B. Canada. C. USA. Or D. Hungary. Answer is option A. Paraguay. Although the levels are high in countries like Canada and America, Paraguay is the highest.
Now we're going to talk about the characteristics of hypertension. As mentioned, the characteristics of hypertension is having a systolic blood or the pressure in the arteries when the heart contracts, pressure reading over 130. It has diastolic pressure above 80, which is pressure in the arteries when the heart relaxes. It involves physical abnormalities that involve cardiac output, peripheral resistance, renin production, and sympathetic neural activity. As for signs and symptoms, the most notable sign is rapid heart rate, which causes increased pressure on blood vessel walls. This leads to increased resistance, which causes the heart to work harder, putting more strain onto the heart. However, this sign might not be noticeable to the patient. Second, vision changes may occur in severe cases. This is called hypertensive retinopathy, and it is because the high blood pressure can damage the blood vessels in the retina. Dizziness has also been reported symptom in some cases. In severe incidents, nosebleeds can result. Finally, shortness of breath can also be a symptom as the high blood pressure can damage arteries and lungs as well. This is called pulmonary hypertension. These are the signs and symptoms that can be reported from hypertensive patients, but hypertension is most often asymptomatic. Often, only when a person gets their blood pressure taken do they realize that they are hypertensive. If this state persists, then they have chronic hypertension. This is why hypertension is known as silent killer. It is damaging to the blood vessels and body, but it isn't clinically obvious.
Question 3. Which of the following signs/symptoms is sufficient evidence to show if someone has hypertension? A. Recurring headaches. B. Shortness of breath. C. Vision changes. Or D. None of the above. The correct answer is D. None of the above. Although all of these are common signs and symptoms, none can be traced directly back to hypertension. Also, hypertension is usually asymptomatic.
Now we are going to move on to some rehabilitation strategies for people that have hypertension. Let us start with some secondary conditions that can occur. The one we will focus on the most is kidney disease, but other secondary conditions that can occur from hypertension include vision problems, heart disease, and even dementia. The main rehabilitation strategy tackled those modifiable risk factors that we mentioned earlier. Exercise is very good for the heart, smoking cessation is highly recommended for those who do smoke, and finally, diet plays a major role in hypertension. And there are many rehabilitation strategies around improving one's diets. This brings us to the DASH diet, which stands for Dietary Approaches to Stop Hypertension. DASH is a heart-healthy eating plan designed to lower people with high blood pressure, hypertension. It emphasizes fruits, vegetables, whole grains, potassium, and lean proteins while reducing saturated fats and added sugars. The main aspect of this diet is the sodium reduction. It recommends 1,500 milligrams per day from the normal 2,300 milligrams per day, which is very beneficial in reducing the risk of hypertension, but also for individuals who already have it and to reduce the chances of secondary illnesses. In addition to the previous factors I mentioned before, the DASH diet also promotes high potassium, magnesium, and calcium, which help relax blood vessels and improve circulation. Finally, the DASH diet has a big emphasis on high fiber and healthy fats because those two support the heart by lowering cholesterol and inflammations. The DASH diet as a whole is an effective strategy for long-term health as it reduces the chances of getting secondary illnesses to hypertension.
Question 4. Which of the following food options would the DASH diet recommend? A. Foods low in saturated fat. B. Foods containing high red meat. C. Foods low in potassium. Or D. Foods high in sodium. The correct answer is option A, foods low in saturated fat. The DASH diet actually promotes lean meats, food high in potassium and low in sodium, which is the biggest part of the diet and why it is so useful in addressing hypertension.
And now we will move on to a research publication that addresses the DASH diet and its relation to hypertension. To analyze the effectiveness of the DASH diet on hypertension, specifically in relation to secondary kidney disease, we will analyze this study held in 2018. Author information can be viewed on the slide, and the URL is underneath for more reference. The study investigated the relationship between adherence to the DASH diet and the development of kidney disease secondary to hypertension. It was a prospective cohort study that analyzed data from approximately 15,000 participants from the atherosclerosis risk and communities study, all of whom had a healthy glomerular filtration rate at baseline. Dietary intake was self-reported and used to calculate DASH diet scores, considering factors such as consumption of red and processed meats, sweetened beverages, sodium, fruits, vegetables, whole grains, nuts, legumes, and low-fat dairy products. These scores were averaged over 2 visits. The primary outcome was the development of kidney disease, defined as a glomerular filtration rate drop below 60 milliliters per minute, 1.73 meters squared, with at least a 25% decline from baseline, kidney disease-related hospitalization or death, or progression to end-stage renal disease, monitored through 2018. Overall, 14,882 participants were involved. During the 23-year follow-up, 3,720 participants developed kidney disease. Those in the lowest tertile of the DASH diet adherence were 16% more likely to develop kidney disease compared to those in the highest tertile, and this was evaluated at a 95% confidence interval of 1.07 to 1.26 with a p-value of less than 0.001. High intake of red and processed meats was associated with an increased risk, while consumption of nuts, legumes, and low-fat dairy products was linked to a reduced risk. The findings suggest that following the DASH diet may lower the risk of developing kidney disease subsequent to hypertension, independent of demographic factors and established kidney risk factors.
Question 6. If a person has kidney disease and hypertension, what can be said about their case? A. Kidney disease was a result of hypertension. B. Kidney disease caused the hypertension. C. The conditions are random comorbidities. Or D. It is possible that hypertension led kidney disease or vice versa. The correct answer is D. It is possible that hypertension led to kidney disease or vice versa. Both of these conditions have compounding effects on the other.
Now let's revisit the case study. Let's recall that Isabella's blood pressure was consistently 150/95. This indicates that she has hypertension, specifically stage 2. Also, after getting screened, she was also diagnosed with kidney disease. She likely had hypertension, and the kidney disease appeared as a secondary condition to it. Overall, it is likely that multiple risk factors contributed to her condition, as this normally is the case for hypertension. These include her older age, history of alcohol, and poor dietary consumption. In addition, she does have a genetic predisposition for kidney disease. Hypertension is increasing worldwide, and it is prevalent, so her case isn't unusual, but she should focus on rehabilitation methods to ease her symptoms and her chances of developing other secondary conditions.
Question 6. Based on everything we have discussed, what would you recommend for Isabella? A. Engaging high aerobic exercise. B. To rely less on fast food. C. Smoke less. Or D. Include red wine at meals. The correct answer is option B. Try to rely less on fast food. Fast foods are often highly processed with high amounts of sodium. Isabella should work towards purchasing healthier grocery bought foods. Although increasing physical activity is also a good rehabilitation method, it wouldn't be the number one thing she should focus on, since she is older and this is unreasonable for her and could even be dangerous. Overall, engaging in the DASH diet may be helpful for her.
Thank you for listening. On the next slides, you'll see our references.